Welcome to my channel. This is Dr. Hani Sinno, a plastic surgeon, and I'm here to talk to you about inverted nipples. Now, this is a very common procedure that I perform in my clinic, and inverted nipples are quite natural and normal. So many women don't know that, and it's really more common than you'd expect. But many women want their nipples to be sticking out and not being inverted. Now, most inverted nipples do come out with stimulation, whether it's mechanical or with cold. Or even with breastfeeding. So women with inverted nipples are able to breastfeed most of the time in a natural, normal way. Some women, although it can be very difficult for the latch reflex to occur, and that's one of the reasons why they may want to fix it. However, the repair of an inverted nipple to truly come out will prevent you from being able to breastfeed. So there are multiple other ways to fix inverted nipples. In my humble experience and with the literature review, and I've tried many other steps, they usually revert. So the treatment, the definitive treatment, which is usually for life, is a very easy 5-minute procedure that can be done under local anesthesia. However, it will prevent a woman to be able to breastfeed. So only once you're done with your family do I suggest you do this procedure. And there's also a chance that the sensation of the nipple may decrease. And so that's also something that has to be taken into consideration. If a woman has very sensitive nipples and it's very important for her, especially during the erotic sensation, then this is not the procedure for you. So let's talk about the inverted nipple and what the pathophysiology, why do women have this issue? So if you can see here, this is one breast on top and this is one breast on the bottom. Now this breast, and this is the side view of the breast, I'm showing you the anatomy. The blue here is the ducts, and here this is the glands of the breast on both sides. So this is the ducts of the glands, and this is the glands themselves, the milk-producing glands. On the top you have an inverted nipple. The nipple is inside, and here on the bottom the nipple is coming out. So the problem, what's going on with a woman that's having an inverted nipple is her ducts are too short. So these ducts here, distance is much shorter than this distance here. And because they're so short, they pull the nipple inwards. But when the nipple is stimulated, the muscle around the nipple pulls it back out. But then it goes back in when it's not stimulated. So the definitive treatment, again, within 5 minutes of local anesthesia, minimal downtime, is we have to cut all these ducts. And that will bring the nipple out in a permanent fashion. But because the nerve is right in that space, that could be the complication that patients have to consider. So in summary, it really is a very easy procedure. It's a very quick procedure, and it can help women and give them hope if they don't like that inverted nipple. Thank you for listening. If you have any questions, please DM us, message us in the comments below, and you're always welcome to call us and come in for a consultation.